I think that the parliamentary committee should just sit back and say, let's find out how we're going to fund and run this thing and then go back to the public. Because otherwise it's just going to limp on. I mean, the projections at the moment are 15 years before it finally rolls out.
The National Health Insurance Policy will have dramatic effects on healthcare funding in South Africa, but are there any legal and constitutional issues with NHI? I'm joined by Patrick Bracher, who's a director at Norton Rose Fulbright, a law firm here in Johannesburg. Patrick, what are the constitutional issues with NHI as you see them?
Yes, thank you. The starting point for me is that we live, thank goodness, in a consultative democracy, and that means that when legislation is put through Parliament, which affects the general population, you have to go through a proper consultation process and give people the right to respond. Now, when the National Health Insurance Bill was first published 3 years ago or so, the Department of Health went around and held public meetings, and then they called for submissions in regard to the existing bill. And they got an enormous number of submissions. I think there are about 7,000 hand-delivered or emailed, and they haven't even been through all those yet. But what the Constitutional Court has said is that it's got to be meaningful participation. And my first issue with the National Insurance Bill is that the consultation so far hasn't been meaningful because there's too much left open-ended. And the two main things that are left open-ended is, firstly, how it works. And you'll find if you look towards the end of the bill, there's a list of regulations that can be published. And there's a list of 28 things that will appear in regulations. And they're very important things about how doctors sign up for the system, how the payments are made. There's got to be a formulary to set out who gets treatment for what. And if it's not on the formulary list, you don't get the benefit of national health insurance. And so there's a number of things that we just don't know about. So I don't know how that can be a proper consultation. The second thing I'll come back to in a minute is the fact that it needs a lot of money. It needs probably about 400 billion on present count. And that means you need what is known as a money bill to go through Parliament. And so far and the money bill is in the hands of the Minister of Finance, and we haven't heard much about how the funding will take place and how they're going to appropriate enough of the money to get it through. And I'll come back to that. The next constitutional issue is Section 27, which says everyone has the right to healthcare services, and the government have got to provide progressive realization in accordance with their means. Now, first of all, everyone, there's a small nuance there. Asylum seekers can only get emergency healthcare, for instance. Now, that's not constitutional because there's judgments to the effect that asylum seekers who are now registered as asylum seekers have rights to all social benefits, and certainly everyone would be including them. So that's a small unconstitutional issue. The second thing is progressive realization, because if you start taking away rights, and there were some presentations to Parliament last week where they suggested they must close down medical schemes and take all their reserves and put it into this function. Well, that's not in the bill. But those who made the presentations haven't read the bill and haven't read the law, because you simply can't do that. You can't take away people's rights and take away their money in order to fund something else. That's not progressive realization.
Enjoying this analysis? Click here to sign up for our 30-day free trial for more content from the CIA.
So Patrick, what about the funding issues that you raised? I mean, I know that the Davis Commission that looked into tax, I think its work is still ongoing, recommended that South Africa, if it were to even think about implementing NHI, would have to have growth rates of north of 3% in order to finance such a mammoth project. What are some of the funding considerations that you're concerned about?
Yes, well, yes, that's exactly right. It's an enormous sum of money. You know, the trouble is we already spend, last time I looked, about 8.5% of our budget on healthcare, and there's about 220 million that goes into that. But there was some sort of assumption that you'll just shift that into the NHI and then everything gets solved. Now, that is one of the biggest problems, because of that money, a lot of it goes into the provincial equitable share. And it's money used at the moment, a very large part of that money is used for the provincial health service and the provincial hospital service, particularly. So you can't just take that money away. They talk about shifting the equitable share back into NHI. Well, you shift it out, then who's going to pay for the hospitals? And it's no good having national health if you've emasculated the hospitals from their money supply and they can't provide the service. So it's not simply a question of shifting the existing money around to get halfway there. And secondly, I mean, you can't take away the equitable share of provinces. It's something they are entitled to. You can't say, well, somehow you've got to manage without the money in future. So that is, that's one of the biggest problems of all. And the money is, as you say, enormous. I mean, when you think about just the cost of running it, of registering 60 million people on a register with their identity documents and photographs, and then registering every single doctor, healthcare provider, pharmacy, you name it, on another register, and then doing the procurement and payments to all these people on a daily basis, just the cost of running it is enormous. The cost of paying for all this medical care is gigantic. And, there's just, that's what I say, until the Minister of Finance comes forward and says, this is exactly how it's going to be funded, and we've got the means to do so, or the means to progressively realize it, we don't know what we're talking about.
So Patrick, where to from here? How do you see this process playing out?
Well, I've been on 3 or 4 platforms now, including platforms shared with government representatives. The state law advisor presented an opinion to the parliamentary committee saying that this was a constitutional law because it's not a money bill and doesn't need a money bill. Well, that's got to be worked out. But you can call it a money bill or call it anything you like, but unless you get the situation where somebody finds where the money is coming from, I don't think, A, it's been properly consulted over, B, I don't think that Parliament could pass this. And, C, the way that money is appropriated is never done in the way that this bill suggests. We don't ever have a situation where you say, here's a special surcharge, here's a payroll tax, here's an expropriation of provincial money, and here's a general tax, and take away your tax credits, and it all goes into health, because every year you have to decide, is there, for instance, a COVID outbreak? Is there a drought? Is there a bigger need for education? So it's not just saying you just set money aside and you go into the future. And if you do it progressively, then you have a very strange situation. You have some people in some provinces who are on the national health and some people who aren't. So there's no explanation at the moment. And I think that the parliamentary committee should just sit back and say, let's find out how we're going to fund and run this thing, and then go back to the public. Because otherwise it's just going to limp on. I mean, the projections at the moment are 15 years before it finally rolls out. But they were supposed to start things in 2017. And one of the things they're supposed to start is something called health strengthening interventions, like a nice little, an HSI, I think it's called. But health strengthening interventions means first put money into improving the current health services. And we know that public hospitals are in disarray. We've seen recent examples. We've seen the Eastern Cape, which owes enormous amounts of money for medical negligence cases. And unless you solve that problem first with some money, and then move into how you fund the bill, I don't think we can go forward in even the foreseeable future. So all those promises made at public meetings have to be revised, and we have to tackle it. I mean, we all would like it. I mean, if we all got national health, which did what medical schemes do for us, that's fine. But let's do it rationally and constitutionally.
Well, of course, it's important that we also crowd people into the private medical schemes. And one of the views that I've heard articulated is that the certain prescribed minimum benefits that regulators impose on private funders also locks out many people who may be on the margins, people who are of a lower income bracket. How have you seen the private medical schemes responding to this very sophisticated lobby around the NHI? You mentioned some of those submissions that were made last week, where there were proposals to expropriate funds from private funders. The private healthcare providers seem to be quite acquiescent in the face of this kind of rhetoric. So how do you see them responding going forward?
Yes, I mean, the responses I've seen from the medical schemes have been guarded. I think, they know as well as you and I do that it's not just going to be taking their reserves and taking sort of private funds. The medical scheme membership hasn't increased much in years, so it's not the solution, but it is the solution for a lot of people. And don't forget, and I always remind when I go on these platforms as government representatives, that it's not that these are people who are doing something kindly for themselves. Everybody who's got a medical scheme and pays for it is not in the public health service system at the moment, saving the public health system money, not costing it money. So we've got to realize that as well. But taking it all and putting it in a tax and trying to make it equivalent to what we pay as tax instead of paying as medical scheme is not the solution, because the one's a private arrangement and the other one's a public arrangement. So I think, just to go back to your question, the medical schemes have been guarded because they are a complementary service to NHI, although NHI is supposed to deal with most things. And I would imagine maybe some of the health administrators could help administer this thing and charge the government money for doing so and doing it properly. So, that's something that still has to be worked out, because until we see a formulary and see what's left as gap cover and additional cover, you don't know what the role of the medical schemes will be. It will be much limited, but it's 20 years down the line, I would think, before you get to that stage.
Thanks very much, Patrick. I think it's important to be critical and skeptical of the policy proposals being put forward by the government and to ask what are the real intentions behind it, but also to submit alternative proposals that will help to extend healthcare to more South Africans. And that's precisely what our friends at the Free Market Foundation will be doing this Wednesday, the 26th of May. They will be hosting a roundtable on NHI. We've put links in the description below, as well as in the pinned comment. Patrick will be a speaker at this event, as well as a number of other leading experts on healthcare in South Africa. My name is David Ansara. This is the Center for Risk Analysis. Until next time, take care.